This educational video resource for rotator cuff related shoulder pain is intended to accompany a comprehensive assessment and exercise rehabilitation program from a suitable healthcare professional. The video aims to discuss the following. What is rotator cuff related shoulder pain and what are the causes? Prognosis timelines for recovery, radiological investigations, management interventions, managing flare-ups and surgery. The most common cause of pain in the shoulder is rotator cuff related shoulder pain. The rotator cuff is a group of 4 muscles and their associated tendons that work together to help move and stabilize the shoulder joint. Sometimes these soft tissues are overloaded or injured and become painful. The pain is usually felt in the upper arm but may refer down to the elbow and bicep. The pain can range from a mild ache to a sharp stabbing sensation and can result in difficulty using the arm during day-to-day activities. If you search this condition on the internet, you may come across many names for it, ranging from rotator cuff impingement to subacromial shoulder pain. This can leave many patients feeling confused. Rest assured, they all refer to the same condition. As we age, our muscles' tolerance for being loaded decreases. Often rotator cuff pain is triggered by an activity using the upper limb that is sudden and requires you to exert a large force that you're not used to. In turn, activities that are more frequent or longer in duration than you're usually exposed to can also be triggers. A very common activity that triggers rotator cuff pain is gardening, as it is seasonal and often involves repetitive or strenuous tasks. People often decide to suddenly start gardening when the weather is good, possibly after many months of not doing so much activity. It's the sudden change in activity that is the problem. Factory workers are also commonly seen in physio departments. The repetitive nature of lifting and moving objects over weeks or months is a common trigger. When the soft tissues around the shoulder are overloaded in these ways, they become painful. In modern healthcare, we understand pain in the context of the biopsychosocial model. This means that we recognise that pain is not just related to structural changes to the body, which may show up on scans and are often normal with ageing. Pain will also be influenced by other aspects of a person's life, such as the lack of sleep, their beliefs about their condition, how concerned they are about it, and other things going on in their life that might be unrelated but still very stressful. These all contribute to the sensitivity of the nervous system. The reason I'm mentioning this is because it is important to recognise that we need to look at the bigger picture of your life and your current mindset. The pain we feel can be amplified by stress on our nervous system and does not necessarily correlate with physical damage. We should not be fearful of gradually increasing exercise during the rehabilitation process, and this will help to calm the nervous system and make the rotator cuff more tolerant of stresses and strains of daily life. In turn, if there are any other activities that you find relaxing, then these should be practiced. Although rotator cuff related shoulder pain is very common, this does not mean it will resolve quickly. If this is your first occurrence of shoulder pain, then it will most likely take up to 4 months to gradually get better, and often our patients do not experience an improvement until after 6 weeks of rehab. If your shoulder pain has been a long-term persistent problem for you, then rehabilitation is most likely going to take 6 months or more. You may have had scans on your shoulder such as an X-ray and ultrasound. While they can sometimes be helpful to confirm a diagnosis and rule out serious pathology, it is important to remember that a lot of the changes we see on these scans are normal as we age. They are like wrinkles. There have been many studies that show people who have never had shoulder pain also have these same changes when scanned. Therefore, we cannot rely just on scans to tell us why you have shoulder pain and what needs to be treated. We've said already that pain is multifaceted and related to many aspects of what is going on in our lives. Getting better usually has nothing to do with structurally changing anything, fixing anything, or seeing an orthopedic surgeon. This leads us to the management. It can be helpful to recognise any triggers for your pain and adjust your activities accordingly. Allowing yourself relative rest from any strenuous activities will help calm the tissues down. We want to practice pacing of our physical activities, so on good days we don't do too much and make our shoulder feel worse, but equally on our bad days we don't neglect to use the shoulder. If we can work in a middle ground with steady increases in activity over time, this will ultimately lead to an improvement in activity levels. If you're not sure how much you should and shouldn't be doing, a good guide is if the activity makes your shoulder pain worse for the rest of the day and the following day, then you have probably done too much. It's normal to feel some pain during activities that use the upper limb, but this should be within limits that are tolerable for you and should not last more than an hour after you have stopped. Pacing activities of daily living, such as housework and gardening, breaking them down into smaller, frequent chunks, is a good idea in the early and mid phases of recovery. Other self-management options in the early phase might include 20 minutes of heat or cold over the shoulder several times to reduce the sensitivity and muscle spasm. TENS machines may also help to calm things down initially, reducing pain and improving movement. People often report that sleeping on the affected side is painful and can disturb their night's rest. It may help to sleep on the non-affected side with the painful arm propped up with several pillows like you're hugging someone. There is a lot of positive research when it comes to exercise for the management of rotator cuff pain. It has been found to be just as effective or better than surgery. The cuff responds well to gradual loading. Also, getting the rest of your body fitter and stronger will help the shoulder function better and be less painful. Exercise programs for rehabilitation of shoulder pain will often include leg and trunk strengthening and spinal mobility, since improvements throughout the kinetic chain of the body can improve how the shoulder functions. Exercise is known to be helpful in the prevention and management of many different health conditions, including diabetes, heart disease, cancer, depression, and anxiety. We know that our general metabolic health is a big factor determining the health of our tendons and other soft tissues. It is worth noting at this point that smokers are 7 times more likely to experience shoulder pain than non-smokers. If you're a smoker, do consider speaking to your GP about resources to help you quit. Medication is an important piece in the puzzle. It shouldn't be avoided because you think it is masking symptoms. Simple over-the-counter pain relief can help settle the irritability of your shoulder and allow you to exercise and move more normally. If you're not allowed to take certain over-the-counter pain medication due to other ongoing conditions, then it would be worth discussing with your GP whether there are any alternatives. If your symptoms are really irritable and preventing you from sleeping or simple exercise, then a steroid injection may also be an option. All medication is used to create a window of reduced pain, which is an opportunity to gradually increase exercise. During the rehabilitation of shoulder pain, it is very common that improvement is not a linear progression, and there will be periods when your shoulder feels worse. This is what is known as a flare-up. Sometimes there will be a known cause for the flare-up, such as too big a jump in activity levels, but other times it appears out of the blue, which is normal as well. In the event of a flare-up, you need to allow a little bit of relative rest and consider returning to your medication and modalities such as hot or cold and TENS for a short period. Regressing the exercises may also be helpful until it is settled. Remember, your pain is not related to damage being caused, but just a temporary increase in the sensitivity of the tissues. Gradually return to normal activities with the long-term aim of trying to strengthen and recondition your shoulder. It can have a role to play in management of rotator cuff related shoulder pain, but for most people it's not necessary. Evidence from large research trials has shown that shoulder surgery was no more effective than exercise. However, for a small percentage of people who have put all their effort into exercise and other conservative measures and the symptoms persist, then there is an avenue to refer you to a surgeon. This should be discussed with an appropriate healthcare professional if you feel this is the best next step. The other reason we do not send people straight for surgery is that there are many serious risks involved with this option that you do not get with conservative modalities. I hope the information that this video provides reduces your concerns and gives you a better understanding of your condition and the recovery process. Thank you for listening, and we wish you a speedy journey back to optimal shoulder health and function.